Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Heart attacks are medical emergencies where swift and effective care is crucial in determining patient outcomes. Understanding the complexities of managing such cases in critical care environments is essential, not just for healthcare providers, but also for patients and their loved ones. In moments when every second matters, having the right knowledge and approach can significantly improve survival rates and recovery. So, our goal today is to explore the strategies, challenges, and vital aspects of managing heart attacks in critical care, equipping us with the tools to respond confidently and effectively in these high pressure situations. Welcome, everyone. I'm Dr. Soumya Saluja from THIP Media, and today we are here to address an urgent and crucial medical subject critical care management of heart attacks. To guide us through this life saving topic, we are honored to have with us the esteemed Dr. Shantanu Ghosh. Dr. Shantanu Ghosh is a highly skilled and dedicated medical professional with extensive expertise in anesthesiology and critical care, with an MBBS and MD in anesthesia and critical care, a doctorate of National Board in critical care. Dr. Ghosh has made significant contributions to patient care, currently working as an intensivist at Rich Candy Hospital in Mumbai. He plays a crucial role in high stakes medical situations, ensuring optimal outcomes for patients in critical conditions. Dr. Ghosh's career is marked by a steadfast commitment to advancing his knowledge and skills in the medical field. His diverse experience in anesthesiology and critical care highlights his ability to manage complex and life threatening situations with expertise. Beyond his clinical duties, Sir is deeply committed to continuous learning and professional growth, consistently staying at the forefront of medical advancements. Sir's role at Rich Candy Hospital not only exemplifies his competence as a healthcare professional, but also showcases leadership within the medical community. Dr. Shantanu Ghosh remains an invaluable asset to the healthcare sector, dedicated to providing the highest standards of patient care. Dr. Shantanu Ghosh, THIP Media welcomes you, sir.
Thank you. Thank you. Thanks.
Thank you. Okay, thank you for joining us today, sir. Okay, sir, we all recognize heart attacks as one of the most life-threatening medical emergencies, right? And
True.
yet, many people they may feel anxious or overwhelmed, when they're actually facing this particular, this prospect of critical management during this event or during such events. So, to help address this concern and provide clarity, I would like to begin this discussion with a very basic question that what is a heart attack and is a heart attack distinctive from a stroke?
So the thing is, if I say in a non-medical people terms to make them understand, heart attack or myocardial infarction in doctor's language is a disease or a condition occurs when heart doesn't get its blood supply, which it should
Okay,
get. So some of the blood vessels of the heart gets clogged with some clot or plaque inside that vessel.
right,
This is heart attack basically is, and stroke is a rather a broad term. So
okay,
stroke includes both the ischemic one and the hemorrhagic one. So
okay,
ischemic ones are basically this. It's similar to heart attack only, but it includes the brain vessels. Okay,
right, right,
okay, and the hemorrhagic ones is when there is a some kind of hemorrhage inside the brain parenchyma. There's some
right,
blood clots inside the brain. So basically, stroke and heart attack in its broad term, if stroke involves brain and heart attack involves heart. That's the
right.
that's the basic
Basic difference.
differences. Okay,
Right.
that's the thing.
Okay. Okay. And like you've just mentioned, that the two conditions are completely not let's not say completely different, but stroke is slightly more complicated than a heart attack involving the brain. Right, sir?
You can't say it complicated, and that's a
Okay.
completely two different entities. So,
Okay. Right.
we
Okay.
have to deal with them separately. I must
Okay.
not say which is more
Okay.
complicated. Okay.
Okay. Right. So both can be medical emergencies, but completely
Yes.
different. Okay. So now coming back to heart attacks, sir, can one having a heart attack recognize or identify its symptoms? And if so, what should the individual who's undergoing that particular event do?
So the main problem lies with the common symptoms of heart attack mimics with many normal non-fatal condition. So
Okay.
in India, patient do present with I do having some gas, flatulence like this, and finally found out to having a heart attack. So
Oh,
that's the issue. So those there are so many normal complaints which can basically the symptoms of a heart attack. We don't
right.
know. So whenever I will now tell you those normal non common symptoms and signs you need to look for. So whenever
Okay.
that's there, you should to ask for medical attention. So the
Okay.
all we know the heart attack starts with a chest pain from Bollywood movies and all. Everyone start
Right.
pressing their
Right.
chest. So that's
Right.
the chest pain and the chest discomfort.
Right.
Specifically, the chest pain is a mainly crushing kind of chest pain. It's more of a something someone had put forward their leg in front over your chest, like that kind of feeling you feel. So that
Right.
heavy, that chest discomfort is the cornerstone of the heart attack thing. And there is a typical radiation pattern, usually involves the left hand and to the back.
Okay.
And but we must not forget about the epigastric pain, which usually we think it's due to stomach pain or something,
Mm-hmm.
can represent a heart attack. So
Okay.
whenever you are having an epigastric pain which is very severe, you should ask for medical attention immediately.
Okay.
So beside this chest pain, you can have nausea, vomiting,
Right.
shortness, shortness of breath. You are feeling out of breath, lightheadedness, palpitations, and diaphoresis. Diaphoresis in broad normal language is you are having profuse sweating without any cause.
Okay.
Okay, these are the main symptoms, signs and symptoms of heart attack. But
Okay.
we need to think about it can it can be so severe that the patient can get unconscious even. That is called
Right.
cardiac arrest. Okay,
Okay.
so these relatives and the other person need to look for whenever a person is complaining these kind of symptoms. We need to ask to the any healthcare facility available nearby, because
Okay.
we need to remember one thing in heart attack, time is muscle. With
Right.
each passing moment, we are losing some heart muscle.
Okay.
So the time is the main crux over here.
Right. And like
That
you just mentioned, that an immediate action is required whenever patient or one of their relatives would recognize or identify one of these symptoms that you just mentioned. Okay. So, if they've noticed, what are the immediate steps they should, which are taken by critical care specialists when the patient, presents with heart attack symptoms to their particular facility?
so the basic thing. So many people, critical care is a very newer specialty in all
Okay.
over the world. In India, so even it's even newer. So we basically don't. The common people doesn't know about what a critical care specialist or intensivist do.
Okay.
So that and an intensivist is a person which basically coordinates between all the primary specialty and deals with all the critical cases.
Okay.
Okay, involving all the specialists, even gynac cases, the critical cases dealt by a intensivist only. So,
Okay.
so the thing is, whenever uh, uh, we attend a patient in the emergency or in critical care unit means ICU, then we just if we consider it's a heart attack, then we run some test And we always follow a rule of ABC. So these
Okay.
ABC is airway, breathing, and circulation. So we need to secure the airway, we need to secure the breathing of the patient, and we need to secure keep the circulation ongoing. So
Right.
these three are the cornerstone of the any critical care management. But
Okay.
we if a, just now I have said a patient can got unconscious or having a cardiac arrest due to severe form of heart attack. So in those cases we have to start CPR. CPR is a
Right.
basically a chest pump to maintain the circulation. By the time we need to put a tube through his mouth to the lungs and
Okay.
put him on ventilator. These are
Right.
all very technical terms I am using, but
Right. I know.
the thing is, this is the thing. So and they we just run some tests. We will do a ECG, echo. These are the basic tests to diagnose a heart attack thing. A ECG, echo, and cardiac enzymes. These are the
Okay.
three tests we run to diagnose a heart attack. And if we feel ki, then if it's a heart attack, then we will not wait for the reports to come even. We'll
Okay.
start, we will plan for revascularization. Just
Okay.
I'm telling you, it's just like a pipe with
Right.
a flowing blood. So if
Right.
it's get clogged with something, we need to open it up.
Right.
So we'll plan to do that in a subsequent
Okay.
manner.
Okay. Right. Right. And so, how does the treatment approach vary for different types of heart attacks?
So the thing is, in broader terms, there is two types of heart attack is there. One is STEMI and another one is non-STEMI. So
Okay.
STEMI basically, these are also very technical terms. STEMI means there is when there is a ST elevated myocardial infarction and
Right.
when there is non-ST elevated myocardial infarction. So
Okay.
in these two terms, ST elevated myocardial infarction always go for revascularization.
Okay.
Means I'll discuss it in a short. What is the revascularization therapy means? I'm talking it again and again. And
Right.
in STEM, in case of non-ST elevated MI, we usually stratify into high risk and low risk cases. If it's a
Right.
high risk, we will go for revascularization, and if it's a low risk or no risk cases, then it can be managed conservatively in a conservative manner with simple
Right.
tablets, simple
Right.
oral medications. So,
Right.
what we are talking about revascularization therapy, these are basically depends on the hospital you are in. So, the
Okay.
facility the hospital is having. If the hospital is having a cath labs, we
Right.
all know about the term cath labs. If the hospital is having a cath lab, then the primary PCI is the choice. Means
Okay.
just do a angiography and
Okay.
do a angioplasty. This
Okay.
is the common term we usually come across in day to day life. So it's
Right.
an angiography and angioplasty we need to do. And
Right.
if it's not, it's a non cath lab facility hospital, then we have to think about other blood thinners also. Those are
Okay.
very strong blood thinners to dissolve that clot.
Okay.
Okay,
Right.
we give very strong blood thinners which dissolve the clot and restore the blood flow. But
Okay.
when a facility having a cath lab, we always go for angiogram and angioplasty.
Okay.
Because in all papers have shown that it is having a better outcome rather than those strong blood thinners thrombolysis therapy.
Okay. Right. Okay, sir. Are there any conventional life-saving procedures that might help save a life in particular situations like
So,
these?
that's the thing which we are talking about.
Right.
So if a patient get unconscious or arrest,
Mm-hmm.
means his or her blood circulation have completely ceased. So we
Okay.
need to restore it as soon as possible, which I was talking about. The
Right.
CPR, the CPR
Right.
and the chest pumping thing.
Right.
It's a basic life support thing.
Okay.
Everyone should know, and it's basically usually free. This
Okay.
training is usually free in India. In our nearby tertiary care hospital, they usually run many a times in the year over the years. to educate people regarding the BLS facility. So
Right.
every possible citizen of a society should know the BLS, and whenever they encounter it, it might happen that you will encounter a heart attack patient inside your office, inside a metro, inside a flight. We usually
Yes.
come across those kind of news in the paper.
Yes.
Some get unconscious arrest. So we should know how to give a proper CPR, how to restore the blood flow till the more uh, more enriched person come over and take over the
Yes.
case. Okay,
Okay.
till then.
Right. Okay.
So
Right.
and other conventional therapy as I talking about, of course, the angiography and angioplasty.
Angioplasty.
Those are the life-saving procedure for heart attack to restore the blood flow.
Okay. Like you just mentioned, that angioplasty and angiography are the two standard procedures or the two life-saving procedures that is actually common and have better outcomes for patients with heart attacks. Are there? I mean, what are the common complications after a heart attack that critical care specialists, they monitor for, and how can family members identify these complications early? And I'm
So
talking about after the treatment has taken place.
yes, yes, got your point. So basically, the thing is there are so many complications. Okay,
Right,
so it can happen due to the revascularization therapy. So there is a whenever you remove the clot, there is a gas of blood
right,
that that can damage the heart wall also. So
right,
it can cause heart failure, it can cause embolus, it can cause a pericarditis, it can cause an
right,
effusion. There
right,
are heartbeats irregularities,
right.
rupture and regurgitation. These are the common complications we do face everyday life in our
Okay,
ICU. But
right.
if you say about the family members, it's very difficult for them, I must say. It's
Okay,
very difficult for them to recognize them. But
okay,
in general, they can see if a person again feeling a new chest pain, if the
okay,
person is again feeling out of breath, if the patient is having a palpitation like feeling,
right,
those they can recognize, and if the patient is still under ICU care, they
right,
reach out the doctor as soon as possible.
right. Okay. And sir, what advancements in critical care have significantly improved the outcomes for heart attack patients?
So, as I was saying, the critical care is a very new kind of branch, and that mainly evolves after this COVID era.
Right,
So, but still in India, it's now all the peripheries even having small hospital. They are now opening up new ICUs. So that's causes a reduction in the number of the mortality in case of heart failure patients.
right,
So so basically in critical care, those highly trained individuals who know how to give a good quality CPR, how to revascularize revascularize a patient. So these new eras and this critical care is always evolving a subject.
right.
Even when we are discussing this all these matter, then might be 10 papers are coming
Yes,
up about these heart attack things. So
yes,
every now and then they are coming up with new ideas, new therapies, and new possible things. So as I firstly recommend, so here time is muscle. So
yes,
we try to do revascularized therapy within 90 minutes of time. So
right,
90 minutes is the goal whenever the patient is having the chest pain, and we do the some post angio or the thrombolysis, we should try to do it within 90 minutes of time. But
okay,
nevertheless, with up to 48 hours, it makes sense. But beyond the 48 hours, that usually doesn't make any kind of sense because the
right,
muscle is gone dead after 48 hours. So that's the thing. Overall, the critical, the reach of common people, even the rural uh, people, they are now possibly able to reach the critical care facility more now and then. So basically, we are every possible cases we are saving lives.
Okay. Right. And now coming on to some challenges probably critical care specialists like you might be facing. So, how do specialists like you, sir, coordinate with other healthcare providers, for the comprehensive management of heart attack
So,
patients?
that's the pivotal role we play in our
Right.
critical care management. So basically, like I, like we are discussing about a heart attack. So
Right.
I'm a critical care physician. So I have to coordinate with a cardiologist.
Right.
I my role is up to the time thrombolysis, and beyond thrombolysis, when the patient is planning to go for an angio, we need a
Right.
cardiologist to be playing the role to do the
Yes.
angio and everything. So we need to coordinate between us, and whenever we in our
Right.
setup we usually do, whenever we are suspecting a heart attack patient, we usually call a cardiologist. He just come over, we just took the decision at that point of time, and from then we plan to do it. We will do the thrombolysis or the angio right away, then we'll take it from there. So
Okay.
it's a I must say it's a chain procedure, and
Okay.
everyone follow the rule, and that's
Yes.
the thing.
Okay. So I think management is the key probably and starting up
And
early.
I think it's a team management. Everyone plays their own
Yes.
role. But
Yes.
it's not only doctor, whoever, every nurse, every paramedics, even the ward boys, they are playing their roles
Yes.
crucial enough to manage a critically ill patient. Because
Right.
even a trolley guy, if he gets late, will lose the time.
Yes. Right. I understand that, sir. Okay. And now coming on to something about recurrence in this event of heart attacks. Uh, how can family members, support lifestyle changes to prevent recurrent heart attacks?
That's a very important key aspects of a common in case of a common people, because
Right.
what we have at till now is a very technical things,
Right.
and but we need to prevent another heart attack. We prevent to
Right.
have a new heart attacks. Okay, but and the alarming things are we are regularly having heart attacks in young and younger generation. I
Right.
just had a patient who is having 29 years old male patient
Oh,
who having a heart attack, and who is
right.
having uh, very horrifying angio report, having a two vessels completely clogged like this. So we need to think about our lifestyle modification per se.
Right.
So and family members play very crucial role in those aspects, because
Right.
they remain with the patient for 24/7. So they can help them modify their lifestyle. They can make them adherence to the treatment modalities which we have prescribed. Because
Right.
if we give medication, but we can't make them gulping it. Nah? So
Right.
its family member is there to help them adhere to that therapy. So
Right.
there are so many medications, first of all, which I
Mm-hmm.
don't get into those details because that will not help you any common people, because there are
Right.
some beta blockers, some AC inhibitors, statins, those to help in modification of the BMI and the heart rates and everything. But in broader terms, the first thing is diet. We
Right.
need to control our diet. So more green leafy vegetables, more lean, having lean meat. Lean meat means chicken, fish like this. No avoidance of red meat. Saturated fat avoidance means dalda like this. Avoidance, more use of sunflower oils, lots of fruits and vegetables, more whole grains, and of course, hydration. Hydration is the key. At least 2.5 to 3 liters of water, unless you are having any restriction of having water intake. Take
Right.
2.5 to 3 liters of water, have green leafy vegetables, less fat, and complete cessation of smoking, and cut your drinking habits. If not,
Right.
you can completely cease it.
Right.
And this is the first diet things gone.
Right.
Then exercise, at least 30 minutes of aerobic exercise every day for
Right.
5 days a week. This
Right.
is the key. Then you need to control your BMI. BMI again a technical term, but many a weighing machine in market. If we put the weight in your mobile also, if you put your height and weight, they will calculate your BMI. So
Right.
BMI calculator is there. Just search in Google BMI calculator, put your height and weight, you'll get a BMI. So keep your BMI less than 25. And if it's not possible, try to reduce your weight in a month
Yes.
at least 10% of your initial weight. So
Okay.
if you are a 80 kg, try to reduce a 80 kg of weight within 1 to 3 months of span. And these are gone: diet, exercise, then weight reduction. Then there are some comorbidities which is making people prone to causing a heart attack. That's
Right.
diabetes.
Right.
So you have to check on your sugar, take less sugar containing foods, less sugary foods, and
Right.
there is a taste of a blood, so that's called
Mhm.
HbA1c, that keeps tracks of your 6 month sugar level. So keep
Right.
HbA1c less than 7.
Okay.
Every 6 monthly, at least if you are more than 40 years old, try to do a 1 hourly lipid profile. Check
Okay.
your triglyceride and lipid profile level under control. If it's beyond under control, take a physician appointment and modify the drugs and everything. And then check your BP regularly. Be
Okay.
you are a heart attack patient or you are just a normal patient, you haven't had a heart attack in your life, try to keep your BP less than 140 by 90 in all senses. And if you have diabetes, try to keep it further below 130/80.
Right.
These are the key.
Okay.
So high diet, cessation of smoking, drinking, exercise, and some basic blood test.
Okay. Right. And what educational resources or training should family members seek, to better support a heart attack patient?
This is a very tricky question. Actually, in India,
Okay.
whenever we open up a mobile and even a TV, so every possible person is giving you health advice. Every possible
Yes.
in your
Yes.
neighborhood also, every possible person come and you shouldn't take this in heart
Yes.
attack. Yeah. So
Right.
even my father, when he have undergone PPM, some neighbor come up and say you don't switch off on light for
Right.
like
Okay.
this. So these are meant to happen. You can't ignore them, but they
Okay.
are there. But I must object. Please don't follow those things because
Okay.
many a times those are very unverified sources. They
Okay.
don't have any scientific basis out of it. So they may cause more harm to the patient rather than doing any kind of good. So
Right.
in India, there are so many good resource rich health magazines are available. Many
Right.
many YouTube sites are available. Many
Right.
Google websites are available. Those are highly resource rich and they are having scientific basis. So
Yes.
please do follow those things only. And
Okay.
if you have any difficulty finding them, just keep in touch with your doctor. Ask him what should I follow. They
Right.
will be happy to help you out. And
Yes.
that's the thing. So don't take social media too seriously. In
Yes.
at least in managing your health. Okay.
Okay.
In
Right.
other places you can follow.
Okay.
And finally, please do try to get a BLS certificate. Please do take a
Yeah.
BLS training from where you can get a basic life support. And you can teach other people also how to give a CPR.
Okay. Okay.
So that will overall help managing
Okay.
heart attack patient overall.
Okay. So I'm just going to reinforce that you've just mentioned. You've just mentioned about the BLS certificate that a regular person should always get. Now, in context with this, in India, we often come across posts on social media, like you've just mentioned, people advising patients to, the patients who are getting a heart attack, let's say, are getting cough or just cough it out or drink water. or they're just the first aid handling methods, they are not they may not be appropriate. So just reinforcing on that part from your end.
So that's the thing I am telling. Just
Yes,
as you say, drink water. Drink
yes,
water. Drink water may be a hindrance for the life of that patient, because
yes,
it can go into his windpipe and completely
yes,
clog the lungs, and he might not
yes,
take breaths in the subsequent moment. So
yes,
don't take those advice. Whenever
right,
you are feeling this patient is having a heart attack, please try to reach the healthcare facility, whichever is
yes,
nearby, as soon
right,
as possible. Get help of a conventionally trained doctors,
right,
whoever is available, or paramedics even. It's
okay,
not possible. It's not possible to cover the whole country with doctors. So whoever
right,
is available, who is conventionally trained in a critical care unit, please take help of those people. Do read health magazines which is approved, but those are having a very good resources. Please
right,
consult your doctor. Please go through websites which are resource rich, which can educate you about the primary management of a heart attack patient. Then we can
right,
save many patients around
right.
us.
Right. Okay. So, sir, I'm just going to summarize this wonderful session by a quick list of do's and don'ts to manage such emergencies that you would suggest your patients.
So summarize, first first thing is, we all know prevention is better than cure.
Right.
So you have to prevent it.
Yes.
So curing is not in your hand. Curing
Yes.
curing is depends on many factors. As I
Right.
say, we have to reach the hospital. We have to do the angiography. We have to do that procedure seamlessly. So
Right.
that procedure itself have some complications. So it's better to prevent it. As I say, control your diet, green leafy
Yes.
vegetables, water,
Right.
lean meat, low unsaturated fat, and lots of healthy grains and low
Right.
fat intake.
Right.
Cessation of smoking and drinking.
Right.
Exercise daily, 30 minutes aerobic exercise at least for 5 days a week.
Right.
Control your BMI, reduce your obesity. That's a key point.
Okay.
And then check on your diabetes and hypertension and lipids under control.
Okay.
These three are the main cornerstone. So if you can prevent it, do prevent it. Still, if you have it, can many a times not only your lifestyle, your genetic things
Yes.
also causing you having a heart attack. So
Yeah.
whenever the heart attack is there, don't panic. Just try to rush to the nearest healthcare facility. Try
Right.
try to keep a contact of nearby facilities which is having a cath lab, so
Yes.
that you can go to them. They are having now what dial numbers also, so that
Right.
you can connect with them. They are having a critical care ambulances nowadays. Critical care ambulances are available in every metro cities. So so basically a critical care unit coming at your doorstep. So you will get the critical care facility within 10 minutes of you are having a heart attack. So
Okay.
do follow and do procure those numbers.
Mhm.
Keep in touch with some doctors and do have a healthy lifestyle. That's it.
Okay.
And try to keep your mind stress free.
Okay. Right. So having a calm mind, a healthy lifestyle, and just preparing yourself beforehand is the key. And we can always save a life. Okay. Okay, great. On that beautiful note, sir, we really appreciate your presence with us today, and I'm hoping that the enlightening information shared will be valuable to many families out there. So thank you so much for joining us today. It's really been a pleasure.
Thanks to all of you. Thanks.
Thank you, sir. And for more such informative videos, please do subscribe to our channel and press the bell icon for regular updates. Thank you once again, sir.
Thank you.